Well, welcome to the Colorado Rural Health Center membership webinar. My name is Bridget Olson, and I am the Outreach Program Manager. Joining me is Jen Dunn, Director of Programs, and Sarah Leahy, the Colorado Provider Recruitment Program Manager. Today's webinar is going to be a brief overview of the membership benefits, including student member benefits. The webinar is scheduled for an hour, but we may end before that time. To mute your line, you can press *6 or use the mute function on your phone. We have scheduled time for questions at the end of the webinar, so you can ask those at that time. With that being said, I will jump right in and discuss a little bit about the history of CRHC for those of you who may not know much about our organization. The Colorado Rural Health Center, or CRHC, is Colorado's nonprofit state office of rural health. We work with federal, state, and local partners to offer services and resources to rural healthcare providers, facilities, and communities. We have a diverse and inclusive statewide constituency of over 3,500 people and organizations. We were established in 1991 by members of the Colorado Rural Health Consortium with startup support from the Federal Office of Rural Health Policy and several other public and private organizations around the state. CRHC was developed as a nonprofit organization and is actually one of only 3 nonprofit offices of rural health in the country. Most state offices of rural health function with public health or other government agencies. So what does CRHC do? Well, we supply organization with funds and equipment such as workforce enhancing loan repayment or scholarships or technical assistant grants to rural hospitals and communities. We act as both a grantor and a grantee, and many of our programs and resources aim to address the healthcare workforce shortage in rural Colorado. And in a few minutes, Sarah will discuss further the recruitment and retention services that we provide. We also offer workshops, training, programs, and technical assistance to facilities and communities such as coding and billing, quality improvement, and grant writing. In addition, we host Colorado's annual Rural Health Conference and the annual forum. These events bring together people and organizations to learn and share information and best practices. We also develop and distribute information on rural health issues. And with our extensive network of partners in the public and private sectors, we are really able to provide assistance and advice and referrals to support rural health needs. Okay. So now a little bit about our membership program here at CRHC. Our mission at CRHC is to enhance healthcare services in the state by providing education and information towards addressing rural health issues. So CRHC funding comes from federal grants, private foundations, membership, sponsorship, and donations. So we rely on grants and contributions to support many of our programs and services. So essentially contributing to CRHC helps fund our programs and services, which in turn strengthens the rural health infrastructure. As the State Office of Rural Health in Colorado, becoming a CRHC member gives you access to countless resources and services provided through CRHC. Some trends as far as membership. In the past, our membership model has looked a little different. Membership is for hospitals, clinics, students, and other small organizations. Currently, the fee is based on the number of full-time employees in your organization. So if your organization has 2 to 9 full-time employees, your rate is $350 annually. Whereas if you have 50 to 99 full-time employees, the rate jumps to $1,000 annually. And you can visit our website for further review of the pricing levels. Students have a base rate of $45 per year or annually. And the membership is an annual rate, so all of our members renew at the end of the year. And we do offer a prorated amount for anyone that joins after June 30th, which would be that half-year rate. CRHC actually switched to the FT, or the full-time model, in 2011, and prior to that, we actually had membership that was based whether you are corporate level, organizational level, an individual, or a student. And a little bit about the student membership. We reinstated the student membership category this year, and currently there are 60 student members in 2013, and students retain all of the same benefits that organizational members have. I'm now going to give an overview of the general membership benefits that really apply to all of our members, whether you're a student, small clinic, or large hospital system. All members receive a discounted rate to attend CRHC-sponsored events, workshops, and webinars. For instance, to attend our annual forum, which is this April, it's actually next week, the 3rd through the 5th, non-members would pay $375 compared to the member rate, which is $220. So this is a savings of $150 per registrant. We also offer a variety of workshops and webinars, and members receive free or discounted rates to those resources compared to non-members. In addition, there are discounted member rates for other resources, and I'm going to let Sarah and Jen discuss those specific discounts that are related to their programs. As a member, you have access to a variety of different resources here at CRHC, and those include technical assistance, group purchasing. You can get notification of pending legislation. We're here to offer personalized assistance for any specific rural needs that you may have. We also have up-to-date rural healthcare policy and advocacy information. We have a monthly e-newsletter, and we also have access to member-only resources. In addition, we have archived educational resources that we make available to our members. For our members, we give them special recognition in our annual report, and they are also listed on our website. The SEED Grant program is available to rural members only and is intended for rural projects whose intent really matches the mission of CRHC. And this is for rural organizational members can apply for these grants in amounts up to $1,500. And the SEED grant is really intended as seed money and should be only a portion of the new program or service. So really the applicant must match the amount requested. In addition, you must submit a final report explaining how you use the grant and the benefits that came about. We also offer the Marva Jean Jackson Scholarship, which is intended for further educational training and is also available to rural members only. We created the Marva Jean Jackson Scholarship to support healthcare training and education, really in order to help address the rural workforce shortage. These grants are intended to match rural community programs that support healthcare training and education for people in their community. So to be eligible, the applicant must be located in a rural or non-metropolitan county in Colorado. And the scholarship recipient must currently be enrolled in the course or start training within 3 months of the application date. Amounts of this scholarship are awarded up to $1,000 per organization per year, and you may reapply for subsequent years. And this is a 2-to-1 match for initial funds. I also wanted to touch on the student benefits and what unique opportunities we have for them. Our goal with student membership is to provide support to new graduates who are entering the field. We strongly believe that we have the resources and information that will assist rural healthcare professionals as they begin their work in rural areas. That being said, students receive the same benefits as organizational members, and again, it's $45 annually. And student members are eligible for up to 3 years as student members. With student membership being a new category, we're really continually trying to seek new and unique opportunities to offer our student members. So currently we are offering students to attend select sessions of our 2013 forum at no charge. And our goal with this is to, help students finesse their resumes or learn about unique challenges and opportunities in rural healthcare, and act as a resource for pertinent healthcare information and policies. I am now going to turn it over to Jen, who will discuss our programs department and what benefits are specifically geared towards hospitals and clinics.
Great, thanks, Bridget. And thanks, everybody, for joining us. As Bridget said, I'm Jennifer Dunn. I'm the Director of Programs for CRHC. Let me just advance my slides here. And so our department provides services and resources for rural hospitals, rural health clinics, as well as in the area of emergency preparedness for Colorado's facilities. So I'll just give kind of a brief overview of some of the benefits that we offer. We provide a wide variety of general services and resources, but CRHC members do get additional free or discounted prices to many of our services. So this is just kind of a snapshot of some of what we offer here. Oops, let me move back one. So just a sampling of some of the services that we offer. We have a peer review network. We offer a variety of quality improvement services, both tailored towards hospitals as well as rural health clinics, such as process mapping, quality system assessments, and a wide variety of other quality improvement services. We also offer some finance and revenue services, such as financial and operational assessments, revenue cycle management types of services. And in addition, we have some HIT, health information technology, and compliance services available as well. Throughout the year, we also offer a variety of educational webinars, and you can find a listing of all of these services plus more on our website under the Programs tab of our website. We have a listing of the programs and services that we offer that are tailored towards clinics as well as the services that are tailored towards hospitals. And our services are really driven by the feedback that we get from our members. So we constantly solicit feedback, evaluation. We want to make sure that the services that we're offering are really tailored to meet the needs of our members throughout the state. So again, you can find additional information about that on our website. I'll kind of give an overview of some of the staff that we have that provide the assistance that we offer to our members. So our department is comprised of program assistant, program coordinator. We have some in-the-field quality improvement specialists, as well as a variety of program managers in all of these areas to help provide assistance to our members, whether it be for questions or technical assistance, or to provide resources to you. So we encourage you to reach out to us at any time. Additionally, we're supported by a variety of senior advisors, too, who are really experts in the fields of quality improvement, health information technology, and hospital and clinic finance that can provide program services and feedback and information to you. So we encourage you to reach out to us, and if you have any questions about any of the services that we offer, don't hesitate to contact us about that. I wanted to give a quick cost savings example for CRHC members versus non-members. So I mentioned that we offer a variety of educational webinars throughout the year. So far in 2013, we've offered 5 webinars throughout the year. And so for CRHC members, there's no charge to attend those webinars. For non-members, the fee for all 5 of those webinars would have been close to $500 for the whole series. So just wanted to give an example of some of the savings that are available through CRHC membership. And with that, I will turn it over to Sarah for some information about the workforce and provider recruitment department.
Thanks, Jen. Good morning, and again, as Bridget mentioned, I am Sarah Leahy, and I'm the program manager for the Colorado Provider Recruitment Program, otherwise known as CPR. I'm hoping that there are a few folks on the line today that are familiar with the CPR program, but for those who are not, I'm excited for the opportunity to share who we are and how being a CRHC member will provide some added benefits to our partnership. So I want to start off by giving a little bit of background about what the Colorado Provider Recruitment Program is. First of all, we are a nonprofit recruitment program. Colorado Rural Health Center started the program over 10 years ago, and we're still going strong. We have a mission to reduce the rural and underserved workforce shortage here in Colorado. And we really strive to find providers who have a genuine interest in both rural and underserved practice and are looking for a community to stay in for the long term. For providers, we hope to find a community or job opportunities for both them and their families that is an ideal match and has professional and personal matches their professional and personal needs, again, for both them and their families. So, who does the Colorado Provider Recruitment Program work with? Well, on the clinic side, we work with primary care providers only, as those are the types of providers that are in the highest need in both rural and underserved areas. Those providers are primary care physicians, including family practice physicians, internal medicine physicians, OBGYNs, pediatricians, emergency medicine physicians, and general surgeons. We also work with advanced practice nurses, including certified nurse midwives and family nurse practitioners, physician assistants, dentists, and dental hygienists. For providers, we work with an array of different types of clinics. All these clinics either serve a rural and or a vulnerable patient population, and they include certified rural health clinics, private and nonprofit rural practices, both rural and urban community health centers, rural and urban clinic-net clinics, critical access hospitals, and other small rural hospitals. So on to our member benefits. If you're contracted with CPR already or thinking about contracting with CPR, why would you become a member of the Colorado Rural Health Center? Well, the biggest reason is that you are able to get your contract fee, which is $500, waived. There are still placement fees that apply, but essentially you have access to Colorado Provider Recruitment services for free for as many positions that you have open throughout the year. CPR provides lots of different services as far as recruitment. The most significant of those are our sourcing and advertising services. CPR is able to travel to all of the physician residency programs as well as the health professional training programs throughout the state and talk to the students and residents about rural practice opportunities as well as give them information about the loan repayment opportunities available to them. We also travel to both local and national job fairs and conferences and advertise your job opportunities, as well as post your jobs on reputable national job boards. So the difference between the contracting fee and the placement fee is that the contracting fee is a one-time annual fee that clinics contracted with CPR pay, whether CPR is able to help them recruit one provider or up to 10 providers. The placement fee is a fee that's charged each time CPR places a provider for your clinic. I'd like to talk a little bit more about our student membership and how that applies to the CPR program. For student members, benefits include a personalized attention to both students and residents in their search for a preceptor or a rotation site. CPR would love to be able to help all students and residents with this very personalized assistance. Our goal and our priority is really to help providers find a permanent job opportunity. But for those of you who are student members, we're able to prioritize our time and help you with locating a rotation site or an opportunity for a preceptor. We're also able to assist you as students and residents and new graduates on the job with your resume as well as building your cover letter and helping you specify your cover letter to job opportunities that you are specifically interested in. We're also able to send you special alerts for different job fairs and conferences that you may be interested in, networking opportunities, as well as loan repayment application deadlines. As a member, if there are any other specific requests that you have as either a student, a resident, or a new-to-the-job employee, as the student membership is available to you for up to 3 years after you start a job as a new grad, please don't hesitate to contact me. And with that, I'm going to turn it back over to Bridget.
All right. Well, we would like to thank you for joining us today and learning more about our membership program here at CRHC. Like I said, if you're interested in learning more, you can visit our website at www.coruralhealth.org. And if you're interested in becoming a member, you can actually sign up for membership online. Otherwise, if you would like a copy of this webinar, you can contact myself again at that email that was listed, and we'd be happy to make that available to you. And at this time, I think we would just like to open it up for questions if you have any.